We're on? Excellent. Welcome to another episode here at Doctors of Podiatry. One of the topics that we really haven't spoken about lately, chronic ankle sprains. Chronic ankle sprains are one of the most commonly encountered clinical presentations that we see here at Doctors of Podiatry. We do see a lot of sports medicine. People from all walks of life, from pediatrics to geriatrics, can sustain and experience an ankle sprain. The difference between a chronic and an acute, right? We've spoken about acute, subacute, and then chronic, right? The timeline. We have a very young patient who presented to our office recently with a chronic pain to the left ankle. Many years. We went ahead and we ordered an MRI. We're not going to go too much into the past medical history, but the problem is that the pain is affecting her daily life activities. So let's talk a little bit about anatomy 101, right? Let's just say this is the fibula. The ankle joint is made up of three bones. We have the talus, tibia, and fibula. So we're looking at this picture kind of like that, right? And the fibula has around, right, 1, 2, and 3, has three very important ligaments. 1, 2, and 3. We have the ATF, CF, and PTF. Anterior talofibular, calcaneofibular, and posterior talofibular. These two, right, are okay. Okay? So we're going to go ahead and erase these and focus on the problem. The MRI, we sent the patient for an MRI, and the MRI revealed a high-grade chronic severe sprain of the anterior talofibular. And one of the we were talking for a long time about what treatments are available, right? We want to avoid the knife, no surgery. What else is available after like 5 years, right? More. So patient has been battling this problem for years. What can we do, right, as clinicians to improve this problem? Aside from the fact that there's a high-grade severe sprain of this ligament, the patient also has a lot of inflammation in the subtalar joint, which is the joint between the talus and the calcaneus, right in there, something that we call sinus tarsi syndrome, okay, which can actually be very uncomfortable as well. So what did I recommend? We spoke about the whole enchilada the other day. I don't know if everyone took a look at that video, but something that has worked really well for chronic. Again, let's use that, put it up here, chronic. PRP. Number 2, percutaneous microtenotomy, also known as the dry needling. And we'll just throw in ozone, even though we did not discuss that, but we'll go ahead and throw it in there also, ozone. This cocktail of treatment works wonders for this and the sinus tarsi syndrome, which is an inflammation between the talus and the calcaneus, which is the heel bone. So what I proposed is, we'll start with number 2, the dry needling. What we basically do is we make these tiny little holes, right? Obviously the patient's thumb. We use a very small needle and we fenestrate the ligament. Procedure number 1. Procedure number 2, then we take the PRP, the platelet-rich plasma, and we marinate, right, the ligament. So if you guys can just imagine, we've created these little micro windows. Now the PRP, which contains the platelets, which contain all these growth factors and proteins and important cells that help in the regeneration of this damaged ligament. And then lastly, we can inject a little bit of ozone, which is again ozone gas, which is another regenerative type of procedure that we perform here at Just Podiatry. And we can also add a little bit of ozone in there to really get that better. In addition to that, I told the patient that we would go ahead and take a little bit of PRP and inject it into the sinus tarsi. So the end result, and we'll keep this nice, short, sweet, and to the point. The end result, if ankle sprains are not treated properly and accordingly, patients can end up with something that's very uncomfortable called chronic lateral ankle instability. It's a feeling that I've never felt before, but hundreds and hundreds and hundreds of patients that have come here to see us, eventually, if not treated properly, they have this, the way that they tell me is that, Dr. Wagner, I have this feeling that my ankle wants to give out on me, that it wants to roll out. And that's a very uncomfortable feeling. The job of these 3 ligaments is to hold the ankle like this. And if there's injury, right, the ankle will want to give out, to the point where if it gives out too much, the patient can actually roll their ankle and fracture either their fibula or another bone in the foot. Excellent educational video. www.justpodiatry.com, our Instagram, Dr. Tojam, our Facebook fan page, Just Podiatry, and lastly, our YouTube channel, Just Healthcare. Like always, thank you for watching.